97% of men do this the wrong way and don't even know they're harming their prostate health. This video can literally save your life or the life of someone you love. If you're a man or know any men, this video is mandatory. We're going to talk about a subject that nobody has the courage to discuss openly, but which is extremely important for male health. I'm talking about the relationship between male intimate activity and prostate health. And no, this isn't taboo, this is science. Today you're going to discover what scientific studies really say about this topic, what are the most common mistakes that compromise male health, and most importantly, how to do it the right way to protect your prostate and prevent serious diseases, including prostate cancer. If you want to take better care of your health or share serious information with someone, hit that like button now and subscribe to the channel. We're going to talk about real health, science-based, and without taboos. Let's go. First, let's get to the facts. The prostate is a walnut-sized gland located below the male bladder. It produces part of the fluid that makes up seminal fluid. And here's the information many people don't know. Prostate problems affect the majority of men after age 50. We're talking about benign prostatic hyperplasia, prostatitis, and even prostate cancer, which is the second most common type of cancer among men worldwide. Now, what does science say about the relationship between intimate activity and prostate health? Several important studies show that adequate frequency of male intimate activity is associated with various benefits for the prostate. A study published in the Journal of the American Medical Association followed nearly 30,000 men and found that those who had regular intimate activity had a lower risk of developing prostate cancer. Why does this happen? There are several scientific theories. The first is that regular release helps eliminate potentially carcinogenic substances that can accumulate in the prostate. The second is that regular activity keeps the gland functioning properly, preventing the accumulation of stagnant fluids. The third theory involves hormones. Regular activity helps regulate testosterone levels and other hormones that influence prostate health. But attention! Here's where what really matters begins. It's not just about frequency, it's about how you do it. And that's where 97% of men get it completely wrong. Now let's talk about the critical mistakes that most men make without even realizing it. These mistakes completely compromise the health benefits, and in some cases can even aggravate existing prostate problems. Pay close attention, because you're probably making at least 2 or 3 of these mistakes right now. Mistake number 1, inadequate frequency, both too much and too little. Here's what science shows. Extensive studies, including research from Harvard Medical School, indicate that the ideal frequency is between 3 to 5 times per week for healthy adult men. Why this specific number? Because the prostate produces fluid constantly. When there's regular activity at this frequency, the fluid is renewed and eliminated in a healthy way, preventing the accumulation of substances that can become problematic. Less than 3 times per week can lead to prolonged accumulation of prostatic fluids, which studies associate with an environment more favorable to inflammatory processes. It's like standing water versus flowing water. Water that flows stays cleaner. More than 5 times per week, especially if done compulsively or mechanically, can cause physical irritation of the gland and inflammation. And attention, if you feel you're doing this compulsively without control, this may be a sign of behavioral addiction that requires professional help from a psychologist or psychiatrist. The balance here isn't just physical, it's also emotional and psychological. Mistake number 2, rushing and excessive muscle tension during the process. This is a huge mistake that practically nobody talks about. Many men do this quickly, in a hurry, intensely contracting all the muscles in the region, abdomen, glutes, thighs, and especially the pelvic floor. This happens a lot when there's time pressure, anxiety, or simply because they learned it wrong since they were young. The problem is serious. Constant and repeated tension in the pelvic floor muscles can lead to chronic pelvic pain syndrome and chronic prostatitis, a persistent inflammation of the prostate that causes pain when sitting, discomfort in the lower back, urinary problems like weak stream and increased frequency, and even difficulties in intimate life. I see patients with chronic prostatitis, and many have no idea that the way they do this activity contributes directly to the problem. The correct way is to do it in a completely relaxed manner, breathing deeply without excessively contracting the pelvic muscles. Think of this as a natural body process, not as an athletic performance. Quality and relaxation are infinitely more important than intensity or speed. When you're relaxed, blood circulation in the prostate improves dramatically, which is essential for gland health. Mistake number 3. Inadequate posture that compromises pelvic circulation. Body position during the activity makes an enormous difference that few people consider. Postures that excessively compress the pelvic region harm blood flow to the prostate. This includes remaining seated for a long time, which is already a problem for those with desk jobs, or adopting positions that directly press the perineum, that region between the scrotum and anus, where the prostate is located just below. This constant pressure can lead to a condition called prostatic congestion, where blood doesn't circulate properly through the gland. Over time, this favors inflammation and can even contribute to the development of prostatic hyperplasia. The ideal is to alternate positions, avoid prolonged pressure on the perineal region, and if you work sitting all day, take frequent breaks to walk and decompress the pelvic region. Your prostate needs good circulation as much as your heart or brain. Mistake number 4. Completely ignoring adequate hydration. This mistake seems simple, but has serious consequences. Adequate hydration is absolutely crucial for prostate health. The prostate produces fluid constantly, and this fluid needs to have the correct consistency. When you don't drink enough water, and most men don't, the prostatic fluid becomes more concentrated, thicker, and this favors inflammation, increases the risk of infections, and can even contribute to the formation of prostatic calculi, which are like small stones inside the gland. Drink at least 2 liters of water per day, distributed appropriately throughout the day, as I've already taught on the channel. Avoid drinking it all at once or concentrating hydration at just a few moments. And be careful with excessive diuretic beverages like coffee and tea, which make you urinate more but don't hydrate adequately. Pure water is always the best choice for prostate health. Mistake number 5. Completely neglecting overall body health. Many men think they can have a healthy prostate while the rest of their body is in deplorable condition. This is impossible. Poor diet rich in saturated and processed fats, absolute sedentarism, smoking, and excessive alcohol consumption directly and profoundly affect prostate health. For example, smoking reduces blood circulation throughout the body, including the prostate, and toxic substances from cigarettes have been associated with increased risk of aggressive prostate cancer. Sedentarism leads to the accumulation of visceral fat that produces inflammatory hormones that affect the prostate. A diet rich in bad fats and poor in antioxidants doesn't provide the nutrients the prostate needs to stay healthy. You can't expect to have a perfectly functioning prostate if the rest of your body is being mistreated daily. Prostate health is a reflection of overall health. Mistake number 6. Not getting preventive exams due to fear, embarrassment, or denial. This is, without a doubt, the most serious and potentially fatal mistake of all. Talking with patients, I constantly hear, "Doctor, I'm afraid of the exam." It's embarrassing. If I don't look for it, I won't discover any problems. This last phrase is especially dangerous because it expresses an illusion. The problem won't stop existing just because you didn't look for it. Prostate cancer is the second most common cancer in men worldwide. In the United States, there are over 280,000 new cases per year. And here's the crucial data. When detected early, the cure rate exceeds 90%. But when discovered late, the chances drop drastically and treatment is much more aggressive and debilitating. The prostate exam, including PSA in the blood and digital rectal exam, can detect changes years before any symptoms appear. The digital exam literally lasts 10 to 15 seconds, doesn't cause pain, just a slight, momentary discomfort. Compared to the possibility of saving your life, this discomfort is absolutely insignificant. Men over 50 should get these exams annually without exception. Men over 45 with family history of prostate cancer or African American men who have increased risk should start even earlier. Don't let cultural taboos or embarrassment put your life at risk. Mistake number 7, use of inadequate materials, improvised objects, or risky practices that can cause trauma. This is a delicate but extremely important subject. Some men, out of curiosity or misinformation, use objects that weren't designed for contact with this sensitive region. Using inappropriate objects without proper care for hygiene, adequate lubrication, or safe format is extremely dangerous and can cause serious injuries. Any trauma to the genital or anal area can result in acute prostate inflammation, serious bacterial infections that can progress to sepsis, formation of prostatic abscesses that require emergency surgery, and even permanent damage to pelvic region tissues. I've already attended emergency room cases of men with serious complications from inadequate practices, and the consequences can be devastating. If there's interest in exploring this area, consult a doctor about safe and appropriate ways, but never improvise with household objects or unsafe materials. Your health and your life are worth much more than any risky experimentation. Now let's go to the scientific recommendations for doing it the right way and protecting your prostate. Recommendation number 1, establish a regular and healthy frequency. Studies suggest between 3 to 5 times per week for most adult men. But attention, this varies from person to person. What's important is having regularity without compulsion. If you feel you're doing this compulsively, seek professional help. Recommendation number 2, practice pelvic relaxation. Before and during, keep the pelvic floor muscles relaxed. Avoid tensing the abdominal region, glutes, and thighs. Breathe deeply and calmly. This improves blood circulation in the prostate and prevents inflammation. Recommendation number 3, don't rush. Set aside adequate time without pressure. Rushing increases muscle tension and decreases health benefits. The more relaxed you are, the better it will be for the prostate and the circulatory system of the region. Recommendation number 4, take care of your posture. Avoid positions that excessively compress the perineal region. Alternate positions and avoid prolonged pressure. If you spend a lot of time sitting during the day, this is even more important. Recommendation number 5, hydrate adequately. Drink at least 2 liters of water per day. Adequate hydration keeps prostatic fluid healthy and facilitates gland function. Avoid excess caffeine and alcohol, which can irritate the prostate. Recommendation number 6, strengthen the pelvic floor. Kegel exercises aren't just for women. Men should also do exercises to strengthen pelvic floor muscles. This improves prostate health, prevents urinary incontinence in the future, and improves intimate function in general. Consult a specialized physical therapist to learn the correct technique. Recommendation number 7, maintain an anti-inflammatory diet. Consume foods rich in lycopene like tomatoes, watermelon, and guava. Include zinc through nuts, pumpkin seeds, and seafood. Increase consumption of cruciferous vegetables like broccoli and cauliflower. Avoid processed meats, excess dairy, and trans fats. Diet has a direct impact on prostate health. Recommendation number 8. Practice regular physical activity. Sedentarism is directly related to prostate problems. Aerobic exercises improve blood circulation in the pelvic region. Walking, running, swimming, or cycling are excellent options. Just avoid excessive cycling, as prolonged pressure on the saddle can irritate the prostate. Recommendation number 9. Control stress. Chronic stress negatively affects hormones and can contribute to prostate inflammation. Practice relaxation techniques, meditation, or find hobbies that help you reduce daily tension. Recommendation number 10. Sleep adequately. Quality sleep is essential for hormonal regulation and recovery of all body tissues, including the prostate. Try to sleep 7 to 8 hours per night. Now let's talk about warning signs you should never ignore. If you have difficulty starting to urinate, weak or interrupted urinary stream, feeling of incomplete bladder emptying, frequent need to urinate especially at night, pain or burning when urinating, presence of blood in urine or seminal fluid, pain in the lower back, hip or pelvis area, or difficulties during intimate activity, you need to see a urologist immediately. These symptoms may indicate benign prostatic hyperplasia, prostatitis, or even early-stage prostate cancer. The sooner it's diagnosed, the greater the chances of successful treatment. Let's talk about preventive exams every man should get. The PSA test is a blood test that measures prostate-specific antigen levels. Elevated levels may indicate prostate problems. The digital rectal exam allows the doctor to assess the size, texture, and detect possible abnormalities in the prostate. Yes, many men resist this exam, but it's quick, doesn't hurt, and can save your life. Prostate ultrasound may be requested in specific cases to better assess the gland. Men over 50 should get these exams annually. Men over 45 with family history of prostate cancer should start even earlier. And African American men have higher risk and should also start exams at 45. Now let me tell you some myths that need to be debunked. Myth number 1. Intimate activity causes prostate cancer. False. Studies show exactly the opposite. Regular activity is associated with risk reduction. Myth number 2. Only older men have prostate problems. False. Although it's more common after 50, prostatitis can affect young men too. Myth number 3. If I have no symptoms, I don't need exams. False. Early prostate cancer usually has no symptoms. Preventive exam is essential. Myth number 4. The digital exam will cause problems or pain. False. The exam is quick, causes minimal discomfort, and doesn't cause any damage. Let's recap the main points. Prostate health is directly related to your lifestyle habits. Adequate frequency of intimate activity between 3 to 5 times per week is associated with prostate benefits. Muscle relaxation, good posture, and not rushing are fundamental. Hydration, anti-inflammatory diet, and physical exercise are essential. Annual preventive exams after 50 are mandatory. Never ignore urinary symptoms or pelvic discomfort. Information is power, and when it comes to health, it can literally save lives. Don't let taboos or embarrassment prevent you from taking care of your health. Talk openly with your doctor, get your preventive exams, and adopt healthy habits. If this video was useful, hit that like button and share it with other men who need this information. Save this video to consult whenever you need. Subscribe to the channel and turn on notifications for more science-based health content. And comment below, "I'm going to take care of my health," to commit to this change. In the next video, I'm going to talk about other important aspects of male health that every man needs to know. Don't miss it. Remember, taking care of your health isn't weakness, it's intelligence. Your life and your well-being depend on the choices you make today. A hug, and see you next time.